Dry eye is increasingly being diagnosed worldwide as well as in our country. Almost 50% of the cases do have dry eye. And meibomian gland dysfunction, there is a prevalence of 35.8% globally, but I think in India it is close to 48 or 49%. There are ways of identifying the dry eye patient, which is done with the ocular surface disease index or various types of questionnaires like dry eye questionnaire, speed questionnaire, etc. And basically this device that I'm going to be talking about is for the meibomian gland dysfunction. So this is just to show how the healthy meibomian glands would look like, and how when there is a dysfunction of the meibomian glands, then they would look like both on the LipiView or ocular surface analysis, and even this can be picked up by autorefractometer. So once this is there and you have done an evaluation of the dry eye by doing the various tests, which include the upper lid and the lower lid imaging, the tear breakup time, MMP9, which is maybe done in some of the centers, tear osmolarity, as well as the clinical evaluation. There are various methods of treating the dry eye and the meibomian gland dysfunction, and often medical intervention and treatment is required. The conventional approaches do include the medications, lid massage, warm compresses, manual expression of the blocked ducts, artificial tears, and omega fatty acids, although it has been shown that they really do not have much role to play. But there are new technologies which provide new non-invasive options to safely and effectively treat the meibomian gland disease and dry eye, and patients continue to seek customized non-surgical office-based therapies to provide symptomatic relief. So this new technology, that is the Envision, it is safe, effective, and is comfortable, is done as an office-based procedure for symptomatic relief of meibomian gland disease and dry eye. And it is a very intelligent programmable workstation which provides the customizable treatments to address the common eye conditions. And there are multiple complementary modalities, so it is like a multi-station which works synergistically. It is also easy to navigate on the LCD touchscreen. So essentially it is got three kinds of handpieces, and it is a multiple technology handpiece device. Forma 1, which is non-invasive, and which is the first bipolar radio frequency probe which has been devised. Then Lumeka 1, which is about 8 millimeters in size. It has a small tip and works on the intense pulse light technology. And I think the inventor of intense pulse light technology is also associated with this Envision technology, and this is mainly for dry eye as well as inflammation. And the Morpheus 8, which has a probe of 1 to 4 millimeters, the principle of which is microneedling, and subdermal adipose remodeling can be done with it. So I think this is more for the oculoplasty people, for puffy eyes, etc. But I think for the cornea specialists, it is the first two, that is the Forma 1 and the Lumeka 1. Small size applicators are there and gives you a precise depth control also, so these procedures can be undertaken. This is how it looks like, the Lumeka 1 spot size intense pulse light. And this ensures precise targeted spot size procedures to treat inflammatory conditions in smaller zones, that is up to 8 millimeters. And it also has light guide cooling along with it, so it does not completely cause burning of the skin, or burning of the skin which is close to the meibomian glands. So the second one is the Lumeka, which uses light energy, which reduces inflammation, and the light wavelength is selectively absorbed by the telangiectatic blood vessels, which coagulates them. So essentially on the principle of IPL, and it also reduces the load of the demodex mites that stimulate the infection, and it stimulates collagen synthesis as well. And indirectly it interrupts the dry eye inflammatory cycle, the vicious cycle that is there, and that is how it affects. The Forma 1 treatment is used to address dry eyes, and it intended use in the periorbital area and the eyelids, and relieves the inflammation of the meibomian glands and the eye irritation. And these are the specifications. There are 2 electrodes basically which are present, and the distance between these 2 electrodes is 4 millimeters. And basically it is the dual electrode which acts on thermal technology, and radio frequency is the principle by which it acts. Again, it is quite efficacious, and it is kind of non-invasive and will relieve the symptoms of MGD as well as dry eye. Now, it is fast, it is effective with a bipolar radio frequency, and first radio frequency device which is available. And I think this we can leave just to show a small animation on how it works. So this I have already told you, it basically has 3 probes which are there, which are available with this instrument. So it helps in the dry eye with or without the inflammation, and also helps in the in cases of puffy eyes as well, and so can possibly be also used by the oculoplasty surgeons. So the treatment for protocol is that for MGD you use Pharma1, and for MGD with inflammation you use Pharma1 with Lumeka, and the third one is actually used by the dermatologist and probably will not fall into our armamentarium. So this was it. Thank you so much for your kind attention. Naresh. So Naresh is here. Naresh, can you tell the cost? Are you allowed to disclose the cost? We've not bought it in RP Center yet, but we are going to buy it very soon. So there are more than 10 here, so you have to give discount to everybody. So there are no disposables, no disposable cost at all, and no hidden cost. But then you've been very honest in revealing a price in amongst so much of audience. Nobody actually does that. They, you know. Okay. Okay.
When it comes to the effectiveness of these handles, I would always say, salespeople would always say good about their product. Let the machine speak, that's what we always say. You would always encourage a demonstration of this machine to, if you feel it like that, okay, you have a space in your practice. Let the machine speak and you see it yourself the kind of.
Okay. Thank you. Thank you so much. Thank you.
I believe that concludes the
We
session.
now request for the group photograph.
Finish.